Welcome to the Electronic Healthcare or EHCP Plan Web-Based Instructions. The Electronic Healthcare Plan Web-Based Instructions were developed to assist school nurses and school nursing administrators in using the West Virginia Education Information System Student Electronic Healthcare Plan Database. The West Virginia Education Information System Electronic Healthcare Plan website was developed in 2006 to accurately measure the specialized healthcare needs of students in West Virginia public schools, which are above a mandated school nurse ratio of 1 school nurse to every 1,500 K through 7th grade students. The legislature allotted $1 million to assist county boards of education with the specialized healthcare of students with higher acuity needs. Many of the reimbursable health procedures are seldom delegatable in the school setting or require more training of school personnel being delegated to by the school nurse. You should have already completed the school nurse data form and submitted it to Linda Payne, who will forward your West Virginia Education Information System number for a username. If you have not done so, please copy Ms. Payne's email address at the end of this presentation to request a school nurse data form, or go to the Healthy Schools website and type in school nurse data form in the search box. The sign-on page will require the entry of your username and West Virginia Education Information System personal password that you have created through your county West Virginia Education Information System access information. You are now on the menu page of the Electronic Healthcare Plan site. As you can see, many healthcare plans are already created for your convenience. If you do not find a medical diagnosis that matches the student's health needs, then open the other link and manually develop your own individualized healthcare plan. I am now going to walk you through developing an individualized electronic healthcare plan, or IHCP. I will use asthma, which is circled for the development of this plan during the training. In order to find the student for which you wish to develop an electronic healthcare plan, please enter their West Virginia Education Information System ID number or do a search for the student name by clicking on the Add button. However, the Add button may take longer to search. The student's name, or a menu with the student's name, will be displayed pending the search route you have chosen. In order to quickly expedite your student name search, if you do not have the student's West Virginia Education Information System ID number, please click on the letter of the alphabet according to the student's last name. After clicking the student's name, you will automatically move to the nursing diagnosis page. The automated EHCP will allow you to check the appropriate nursing diagnosis for this student's HCP. Only one nursing diagnosis per individual care plan is allowed. If none of the options match the student's needs, please create your own nursing diagnosis in the Other Nursing Diagnosis field at the bottom of the page. After choosing one nursing diagnosis, please click Save. The program will automatically move you to the page for selection of student goals. If you view the goal header at the top, it will always describe what section of the nursing care plan you are working on. As for this section, you are working in the Goals for Nursing Diagnosis. Please click on the appropriate student goals and then click Save when finished. Although an automated save has been incorporated into this program, the programmer suggests you always hit Save prior to proceeding. You will now need to select the next section of your healthcare plan, which is Interventions. Interventions for the nursing diagnosis is identified in the goal header at the top. Please select from the multiple interventions that apply to your goal and hit Save. The programmer has incorporated the user buttons in sections throughout this lengthy list to allow you, for user convenience, for clicking the Save button. We will now click on the expected outcomes for this healthcare plan. The expected outcomes will again provide a menu selection to meet the health outcomes you select for the student throughout the school year. Again, select the appropriate interventions and click Save. Now move to the final step in selecting the category Procedures. Procedures are medical provider ordered care for the student during the educational day. Note the word ordered. The procedures must be ordered by a medical provider and not only through a parent request. The student in this demonstration has a health provider's order for a meter dose inhaler and peak flow meter during the school day. Please note the asterisk beside certain healthcare procedures. The procedures with an asterisk will provide you with an extra step in assuring you are meeting the requirements of the asthma and/or diabetes laws in West Virginia. You will also notice the statement reimbursable procedure in bold beside certain procedures. This is to inform you that this procedure will be counted in the $1 million reimbursement provided by the legislature to the West Virginia Department of Education for distribution to counties for students with specialized healthcare procedures above the West Virginia school nurse ratio. Please note the procedures are weighted. For example, ventilator care will provide more reimbursement than a simple meter-dose inhaler. After selecting the medical provider-ordered healthcare procedures during the school day, click on the Save button. This section provides a reminder or allowance for documentation to meet the asthma and diabetes law requirements. For example, the asthma law requires the school nurse to do an assessment of the student and deem the student capable of carrying an inhaler. If the student is not deemed capable to self-administer an asthma inhaler at the time of the nursing assessment, then the school nurse will continue to educate the student so he or she will eventually be able to self-manage and carry an inhaler if developmentally and physically capable. Please use this area to ensure the law requirements are met and documented. Now click on the Save button and the Menu button to proceed. You have created an individualized healthcare plan or IHCP at the click of a few buttons. Now click on the student's name to view the individualized healthcare plan in its entirety. This is the final healthcare plan. It will be saved in the statewide West Virginia Education Information System with the tracking of your West Virginia Education Information System ID. You also have the capacity to print the document with menu print buttons at the top of this page. You can go back to the main menu by clicking on the Close Window button located at the top of this page, which is not viewable on this slide. I will now click on the Asthma button. Every new school year the Educational Healthcare Plan program is set up to move the individual educational healthcare plans to an active and waive for your annual review of orders and student assessment, as required by West Virginia State Board of Education Policy 242.7, Standards. For basic and specialized healthcare procedures in WV Public Schools and Family Educational Rights and Privacy Act. If it is the start of a new school year and you click on asthma, then you find all records are inactive, hence no records in the active database. Although no health records exist in the active asthma database, look at the left-hand corner of the screen. The left-hand corner of the screen shows Go to Inactive Records. The individual educational healthcare plans have moved to an inactive file awaiting your activation. After reviewing the new medical providers or prescribers orders and assessing the student, simply click the bold blue font stating "Click here to activate or update the record." You can make any needed changes upon updating the record. The record will automatically move back to the active file after you press the Click Here button. If you have any records you have not updated or deleted, they will move to an active site on each student health record, such as asthma, diabetes, etc. If you wish to delete this student's record from the database because the student transferred out of state, is deceased, etc., then click on Delete Inactive Record. The summary data file was created to provide you with a glance at the student needs, your workload, and a data file of the real-time healthcare needs and procedures provided in your county. The summary data file will list the nurses, number of same nursing diagnoses in the county, and number of procedures claimed on the educational healthcare plans. The West Virginia Department of Education, Students Used for Funding, County button allows you to review the data on the students with specialized healthcare with higher acuity needs in which your county will be receiving reimbursement funds. It may assist you in the review of all qualifying specialized healthcare procedures. The West Virginia Council of School Nurses were created by West Virginia Code 18-5-22 to develop specialized healthcare procedures and training for West Virginia public schools. The intervention guides circled on the screen were created by the West Virginia Council of School Nurses to assist school nurses in developing guides for teachers and school personnel providing specialized healthcare procedures or emergency care to students in the school system. The intervention guides are voluntary but make a great resource for a layperson who would never understand the intent of a nursing healthcare plan nor be able to provide care based on the healthcare plan. I hope you find these intervention guides useful and incorporate them into your delegation and educational training for school personnel. Finally, once you have developed, updated, reviewed pertinent data and exhausted the electronic healthcare plan site, you can sign off in the lower right-hand corner. I hope this electronic instruction training program for the West Virginia Education Information System Educational Healthcare Plan web-based site has proven to be helpful in guiding you to easy use of this program. Your feedback for future changes and improvement to this system is greatly appreciated.